Welcome to this premium healthcare explainer for the Medicine Diary. We're jumping right into a massive structural shift happening in U.S. healthcare right this very second. We are looking at the rapidly changing and honestly fascinating landscape of addiction medicine. We'll explore what it actually takes to become a specialist, the incredible financial incentives on the table, and a controversial, looming deadline that could fundamentally alter patient access across the entire country. Let's get right into it. So, we have to start with a number that is just staggering. Right now, there are approximately 20 million Americans fighting substance use disorders. 20 million. But to treat them, we only have about 4,400 board-certified addiction specialists. I mean, think about that ratio. It creates this critical void in patient care. So how do we bridge this massive gap? It's a desperate question for so many communities, and it's exactly what the medical system is scrambling to answer.
Here's our quick roadmap for today's explainer. 1. A summary of the core facts. 2. Why specialize. 3. The 2 paths to certification. 4. A critical analysis of the controversy. And 5. Our audience takeaways.
All right, Section 1, Key Point Summary and Core Insights. Let's break down the macro-level situation. Like we said, 20 million patients, but only 4,400 certified doctors. To attract talent, the 2026 median compensation has surged to an impressive $315,000. To get there, doctors currently have 111 accredited fellowships to choose from. But, and this is a massive but, an alternative route called the practice pathway is expiring between 2025 and 2026. This shift to a fellowship-only model is sparking a really intense debate over rural access to care. Moving on to Segment 1, Why Specialize in Addiction Medicine? Well, what's really interesting here is the tangible financial reality. According to 2026 data from SalaryDoc, which is based on verified physician reports, the median total compensation for an addiction medicine physician is a staggering $315,000. And remember, that's just the median. Top earners, especially in big cities like New York, are actually making upwards of $400,000 or even $500,000 a year. Absolutely wild. But hey, the financial picture goes way beyond just the base salary. The American Society of Addiction Medicine points out some massive professional benefits. For instance, if you practice in a designated geographic area for 6 years, you could literally see up to $250,000 in federal student loan forgiveness. That is huge. Plus, board certification generally yields a 67% higher earning potential compared to uncertified peers. And with specific CMS taxonomy codes now in place, securing billing reimbursement is, thankfully, highly streamlined. Segment 2, 2 paths to certification. So how does a physician actually get certified and tap into these benefits? Well, first, candidates have to pass a really rigorous board exam under the American Board of Preventive Medicine. The content outline places a heavy 40% emphasis purely on practical screening, assessment, and intervention. They also test heavily on neurobiology and epidemiology, with key focuses on alcohol, nicotine, and opioids. It essentially ensures that any certified doctor is truly an expert in both the hard science and the everyday clinical reality of addiction. Now, to even qualify for that exam, physicians are basically facing a crossroads right now. Option 1 is the traditional 12-month accredited fellowship program, typically running on a July to June academic calendar, and by 2026, this will be the only pathway. Option 2 is the practice pathway. This is a grandfathering route based on documented clinical experience, meaning no fellowship is required. But, and this is the huge shift we mentioned, this pathway expires completely for the ABPM by June 30th, 2025. It's a hard stop. For those who will be required to take the fellowship route, the ACGME has very strict requirements. Programs must provide access to acute care facilities, plus comprehensive inpatient and outpatient training. But impressively, they do cast a really wide net. They accept applicants who have completed residency in any of 24 different primary specialties. We're talking everyone from emergency medicine to pediatrics. Segment 3, Critical Analysis and the Practice Pathway Controversy. This brings us to perhaps the most pressing issue in the field today. While fellowships are undeniably great for standardizing care, there is a very real bottleneck. Looking at the 2024 National Resident Matching Program data, a concerning 1/3 of all addiction medicine fellowship positions went completely unfilled. I mean, half of all programs had at least one empty slot. And this is exactly why critics are sounding the alarm. The Journal of Studies on Alcohol and Drugs argues that ending the practice pathway is incredibly disruptive. Think about it. For a mid-career doctor in a rural area to get certified now, they'd have to abandon their current patients and relocate to a city for a full 12 months. The authors argue this will severely hurt rural access and heavily limit the diversity of the workforce. So, looking at this impartially, here is the breakdown. It is absolutely accurate that transitioning to fellowships ensures standardized, high-quality education and clinical outcomes. However, a correction really is needed in how the medical boards handle this transition. They need to acknowledge the massive financial and career barriers a 12-month fellowship presents for established generalists in rural areas. And finally, what's totally missing right now? Transparent data tracking exactly how this fellowship-only model will actually affect vulnerable patient communities going forward. Segment 5, Audience Takeaways. Okay, what should you take away from this explainer today? Here are 3 actionable steps. Number 1, audit your eligibility today. If you have clinical experience treating addiction, do not wait. Go take the ABPM eligibility quiz online before that June 2025 deadline closes forever. Number 2, evaluate the ROI. If you're considering the fellowship route, carefully weigh that incredible $315,000 median salary and loan repayment against the temporary cost of stepping away for a year. And number 3, healthcare systems must plan for the future. You have to find ways to support your local generalists who want this fellowship training so you don't lose local access to care. We leave you with this final, provocative thought. As the rules of board certification change, who ultimately pays the price? Does standardizing the education save more lives? Or does restricting the pathway leave those 20 million struggling patients waiting even longer for help? It's a tough question. Thank you so much for joining this premium explainer. If you found this breakdown valuable, please subscribe and visit themedicinediary.com for more science-based healthcare awareness. And hey, we really want to hear from you. What are your thoughts on the expiring practice pathway? Drop your perspective in the comments below, and we'll catch you in the next one.